Every morning, millions of people over 60 take a vitamin, believing it's helping their brain, their heart, their health. But what if I told you one of those pills could quietly raise your risk of a stroke? I've treated stroke patients for 30 years, and some of the most heartbreaking cases were caused by vitamins taken the wrong way. They felt fine the night before, then woke up unable to move their arm or speak. What went wrong? High-dose vitamin E can thin your blood too much. Ginkgo? It sounds natural, but it can mess with blood vessels and lead to bleeding. Fish oil and aspirin together, risky combo. Even caffeine, taken with certain supplements, can send your heart into dangerous rhythm. And most people never know the danger until it's too late. So here's what I want you to do. Bring your vitamins to your next doctor visit. Check for duplicates, same ingredients in different bottles. Be careful if you're on blood thinners. Don't assume natural means safe. Just try this tomorrow. Read your labels. Ask questions. Because your brain has protected you for decades. Now, it's your turn to protect it. If this helped, follow the channel, Senior Health Tips 365. Leave a comment. Let's make sure everything you take is truly helping you. And now, let's uncover the vitamins that look harmless but are secretly destroying us.
Have you ever taken vitamin D thinking it's the best thing you can do for your bones? That's what most people believe. It's called the sunshine vitamin, right? Good for bones, immunity, even mood. But there's something no one tells you. Too much of it, over time, can quietly harden your arteries and lead to a stroke. I had a patient, 78 years old, a retired engineer, smart, disciplined, took care of himself. Every morning, he'd open his pill box and take 10,000 IU of vitamin D. He told me, "My bones feel strong. I feel great." Then one morning, his wife found him on the floor. He couldn't speak. The whole right side of his body wouldn't move. He had a massive stroke. His blood tests showed sky-high levels of vitamin D and dangerously high calcium. Here's what happened. Simple version. When you take too much vitamin D, your body absorbs too much calcium. But it doesn't just go to your bones. It starts building up in soft tissue, especially the lining of your arteries. This makes them stiff and narrow, like turning a garden hose into a hard plastic pipe. That's called arterial calcification. And when blood can't move freely, you're at risk for blood clots. One small clot can block flow to your brain. And just like that, you wake up to a different life. No warning, no pain, just silence. A silent stroke. Now here's the twist. Most multivitamins already contain 600 to 800 IU of vitamin D. That's enough. But many of you are doubling or tripling that with separate supplements. 5,000, even 10,000 IU a day. You don't feel anything wrong until something goes terribly wrong. So if you're taking vitamin D every day, here's what I want you to do. Check the label. Add up how much you're really getting from all sources. Don't assume more means better. If you're not sure, just ask your doctor to test your vitamin D levels. It's a simple blood test. It could save your brain, because you deserve to feel strong, but also safe. Try this tomorrow. Look at your supplements. Just that, one step. That's how change begins.
Have you ever thought, if one vitamin C pill is good, then 2 or 3 must be even better? That belief sounds harmless. You hear it everywhere. Vitamin C boosts immunity, fights colds, protects your cells. And yes, at the right dose, all of that is true. Vitamin C is water-soluble, so your body flushes out the extra. That's why most people think, you can't take too much, what's the harm? But here's the truth. That very safety net has made people careless.
I've met many patients who take megadoses of vitamin C every day, sometimes 1,000 milligrams, sometimes 3,000 or more. They feel they're doing the right thing. They want to stay strong, avoid getting sick, but the body doesn't always respond kindly. The first signs are small: bloating, nausea, loose bowels. Your gut tries to flush out the overload. But for some people, the damage goes deeper, especially those with a history of kidney problems. Too much vitamin C over time can increase oxalate in the urine. Oxalate is a crystal-forming substance, and that's where kidney stones begin. Imagine trying to pass a sharp, jagged stone through a narrow, delicate tube inside your body. It's not just painful, it's excruciating. And most people never suspect that their vitamin caused it. What makes this tricky is that you won't feel anything until it's already happening. And the amount you actually need? Much smaller than you think. Just 75 to 90 milligrams per day. You can get that from one orange, half a cup of strawberries, a handful of broccoli. You don't need pills the size of your thumb. You don't need 3 scoops of powder. Sometimes more is not more. It's too much. Your body doesn't need megadoses. It needs balance. And that balance often starts not in the medicine cabinet, but in your kitchen. Have you ever taken a vitamin for years, then found out it might be doing more harm than good? You're not alone. We've all made choices with good intentions, but without the full picture. Share your experience in the comments. I'd love to know, what's one vitamin you used to take but don't anymore? And if this video gave you a new way to look at your health, tap like, share it with someone you care about, and follow Senior Health Tips 365. Because the more we talk, the stronger we get together.
Have you ever taken a multivitamin without reading the label all the way? That sounds like a small thing, but for someone on blood thinners, it can be the beginning of a silent war inside your body. Let me tell you a story I'll never forget. A 74-year-old man, sharp, active, thoughtful. He had a history of blood clots, so his doctor had put him on warfarin. It was working. His blood was flowing just right, not too thick, not too thin. But one day, his daughter bought him a multivitamin. She wanted to help. She said, "This'll make you stronger, Dad." And he trusted her, so he took it every morning. 2 weeks later, his blood work looked strange. His INR, the number we use to measure clotting, was falling fast. That meant his blood was becoming thick again, dangerously thick. He felt fine. No pain, no warning. But inside, a clot could have formed at any moment, in his lungs, his heart, or his brain. And the reason? The multivitamin had vitamin K. Not a huge amount, but just enough taken every day to cancel out the effect of his blood thinner. He didn't know that vitamin K helps blood clot. He didn't know it was quietly working against his medication, and no one had warned him. That little pill was undoing the very protection keeping him alive. It wasn't the medicine that failed, it was the mix. Because even something as healthy as a vitamin can become dangerous when it's combined with the wrong medication. And here's what makes it even trickier. Vitamin K isn't always clearly labeled. Sometimes it's hidden under another name. Sometimes it's in food powders or green super blends. Sometimes it's added to heart support gummies. You don't see it, but your blood does. This man was lucky. We caught it in time. But many people don't. That's the hard part. You can feel perfectly fine, even while your body is walking toward a stroke. And you'll only know
when it's too late. If you're on warfarin or any blood thinner, every small thing matters, even a vitamin. You don't have to fear your food. You just need to know what you're putting in your body. Because sometimes the most dangerous thing is not what you feel, but what you never see coming.
You probably know vitamin E as something good for your heart. A natural antioxidant, protects your cells, prevents damage from aging. It sounds like a gentle helper, doesn't it? But have you ever wondered what happens if you take too much? Especially when you're already on blood thinners. I remember one patient clearly. She was 81, a retired librarian. Smart, careful, always reading labels. She had a heart rhythm issue, very common in older adults, so her doctor prescribed a standard blood thinner. Her condition was stable. She walked every day, lived independently, still wrote letters by hand. Then one day, she saw a bottle of vitamin E at the store. The label said heart health, natural support, 800 IU per capsule. She thought, if it's natural, it must be safe. She started taking one capsule every morning. Didn't tell her doctor, didn't feel anything wrong. Until one night, she got a sudden headache, then confusion, then collapsed. A scan showed bleeding inside her brain. It wasn't a stroke from a clot. It was a hemorrhage caused by blood that had become too thin to stop bleeding. The vitamin E wasn't poisonous, but when added to her prescription blood thinner, it tipped the balance too far. Her blood couldn't clot when it needed to, and all it took was one small, fragile vessel in her brain. That's the danger most people don't see. Vitamin E in high doses acts like a natural blood thinner. It slows clotting, which might sound helpful, but only if your blood isn't already being managed. If you're on warfarin or aspirin or Plavix, and then you add 400, 800, or even 1,000 IU of vitamin E, your blood can become dangerously thin. And the scary part, there's often no warning on the label. No one at the store tells you. You just think you're helping your heart. But inside, your blood is changing, silently. That woman survived, but she lost her short-term memory, and now she needs a walker to move around. A kind, careful woman trying to do one good thing for herself, and it turned her life upside down. You don't need to fear vitamin E, but you do need to know the dose. The daily requirement? Just 15 milligrams. That's about 22 IU. Some supplements are 20 to 40 times that, sometimes even more. And when combined with blood thinners, the result isn't better health, it's higher risk. The truth is, not everything natural is gentle. Not everything good for your heart is good for your brain.
You ever felt a strange tingling in your hands or feet? Like something's off, but you can't quite explain it. Most people brushing off. They think it's just old age, or maybe arthritis. Poor circulation, nothing serious. But sometimes that tingling is your nerves quietly crying out for help. I remember a patient, 76 years old, used to be a truck driver, strong hands, sharp mind, still enjoyed working on his tools in the garage. But over time, he started to feel numbness in his fingertips. His legs felt heavy. His balance wasn't the same. One night, he tripped, fell hard. That's when his wife brought him in. We looked through everything he was taking, and right there, a nerve support supplement. The bottle looked harmless, said things like brain booster, supports circulation. But inside, Each pill had 100 milligrams of vitamin B6. He'd been taking 2 a day. That's 200 milligrams, over 100 times the daily amount his body needed. And he had no idea. Unlike other B vitamins, B6 doesn't just wash out in your urine. It stays. It builds up. And when it builds too high, it turns toxic to your nerves. Imagine the protective coating around your nerves like insulation on a wire. Vitamin B6 in high doses starts stripping that insulation away. You can't feel it happening, but slowly your nerves lose their signals. You lose strength, you lose balance, and eventually you lose your independence. That man now walks with a cane. He can't drive. He struggles to button his shirt. He told me, "I just wanted to protect my brain. I didn't know I was poisoning it." The truth is, you only need 1.7 milligrams of B6 per day. You get most of that from food, bananas, chicken, oats. But some pills give you 50, 100, even 200 milligrams every single day. And the damage? Once it's done, it may not heal. So if you're taking any brain or nerve supplement, just take a moment tomorrow. Look at the label. Ask yourself, do I need this much? Because sometimes the thing you're taking to protect yourself is what's quietly taking your strength away. What's one health habit you trust but never questioned? And if you found this helpful, hit the like button, share it with someone you care about, and follow Heart and Brain Health for more quiet, powerful insights just like this.
You probably know vitamin A as the vision vitamin. It's in carrots. It's in your multivitamin. You might even take it to support your immune system or your skin. But what most people don't know is this. When you take too much vitamin A, especially over time, it doesn't just sit quietly in your body. It builds up. And in some cases, it turns into pressure inside your skull. I remember a patient of mine, a 79-year-old retired piano teacher. Sharp mind, gentle voice, still teaching lessons in her living room. Then one day, she started getting headaches, not just once in a while, but constant. Then came the blurred vision, dizziness, and slurred speech. Her family thought it was a stroke. They rushed her to the ER. But the scans showed something strange. There was no clot, no bleed. Instead, her brain was under pressure. The fluid around it was pressing too hard against the skull. The diagnosis? Pseudotumor cerebri, a false brain tumor, not caused by a mass, but by vitamin A toxicity. She had been taking a high-dose supplement for skin and vision, 10,000 IU of vitamin A every day for years. And on top of that, her daily multivitamin also had more vitamin A. No one told her that vitamin A is fat-soluble. It doesn't flush out like vitamin C. It gets stored in your liver, in your fat, in your tissues. And as we age, our body clears it out more slowly, so the buildup happens faster than we think. Too much vitamin A raises the pressure of the fluid around your brain. It sounds small, but that pressure can blur your vision, make you dizzy, and even affect your memory. Many people mistake it for migraines, or brain fog, or normal aging, but really, it's the brain silently suffocating under pressure it can't relieve. That patient is still recovering, but her eyesight will never be the same. She told me, "I just wanted to do something good for my body. I didn't know it could hurt my brain." The safe upper limit for vitamin A in seniors is around 3,000 IU a day. But many over-the-counter supplements contain 5,000, 8,000, even 10,000 IU per pill. And if you take more than one supplement, you may be stacking those numbers without knowing it. Just try this tomorrow. Take a moment. Check your label. See how much vitamin A you're really getting. Because sometimes the very thing you take to protect your vision could slowly, quietly put pressure on your brain. You ever feel your face suddenly turn hot? Like a flush rising up your cheeks, out of nowhere. Then your heart pounds. You feel lightheaded, maybe even a little off balance. Most people think it's just anxiety, or maybe their blood pressure meds acting up. But sometimes that hot flush is your body trying to tell you something bigger. I had a patient, 72 years old, retired postman, walked every day, ate well, wanted to avoid statins, so he started taking a natural supplement for cholesterol. The label said heart healthy. He trusted it. But when I looked closer, each serving had 1,000 milligrams of niacin, and he was taking 2 a day. That's 2,000 milligrams, far more than any senior should ever take without medical supervision. And then the symptoms started. Red face, thumping heart, dizziness that came and went. Then one day, his speech slurred, just for a few minutes. Then it went back to normal. He thought it was nothing. But that was a TIA, a mini stroke, caused not by bad cholesterol, but by his supplement. Here's what happens with high-dose niacin. It causes your blood vessels to suddenly open wide. That's the flush. Then, just as fast, those vessels snap back. They tighten again. That yo-yo effect messes with blood flow to your brain. And when that flow gets cut off, even for a short time, your brain suffers. You might not feel it right away. You might not even remember it, but each episode adds up. And one day, the symptoms may not go away. For older adults, anything over 50 milligrams of niacin a day should only be taken under medical supervision. Not 500, not 1,000, and definitely not 2,000. If you have high blood pressure, if you're taking medication for your heart, or if you've had a stroke in the past, too much niacin can quietly set the stage for the next one. Just try this tomorrow. Check the back of your bottle, look at the number. If it's over 50 milligrams, talk to your doctor. Because sometimes the thing you take to protect your heart can quietly put your brain at risk. After everything we've talked about, the hidden risks behind common vitamins, you might be wondering, so now what? What should I take instead? I know how that feels. You try so hard to take care of yourself. You buy the pills that say heart, brain, bones, but you still feel tired or dizzy or foggy in the head. I had a patient like that. She was a retired school principal, strong-minded, kept a drawer full of supplements, vitamin D for bones, E for the heart, B complex for energy. But her balance was off. Her blood pressure kept climbing. She felt like her body was working against her. So we tried something simple. We put the pills away, and we brought food back in. No fancy rules, no trendy diets, just real, whole foods, the way your body was built to absorb nutrients. Her breakfast became a small bowl of oatmeal, a handful of walnuts and blueberries, and a glass of water. Her lunch? Spinach salad, a piece of salmon, olive oil, a slice of whole grain bread. Within weeks, her dizziness faded, her pressure came down, and she looked me in the eye and said, "My brain feels clear again." Why did it work? Because your brain doesn't want megadoses. It wants balance. It wants healthy fats from avocados, nuts, and fish. It wants antioxidants from berries, leafy greens, and olive oil. It wants stable energy from oats, brown rice, whole wheat bread. And it wants water. Enough water to help blood flow, flush toxins, and keep your thinking sharp. These aren't exotic superfoods. They're real, everyday things, but they work. They support not just your brain, but your heart, your bones, and your mood. They don't clash with your medications. They don't build up quietly in your liver.
They help your body do what it's always known how to do: heal, balance, protect. Try this tomorrow. Instead of opening a pill bottle, open your fridge. Just one small change: a handful of berries, a spoon of olive oil, a glass of water with breakfast. That's where real protection begins. You've come this far in life by listening to your body and learning what truly matters, not just what's trendy, but what's real. You don't need more noise. You need quiet clarity, step-by-step support from someone who understands where you are. That's why I created this channel, Heart and Brain Health. It's a place just for you, a calm corner where we talk honestly about aging well, without fear, without pressure. So if this conversation helped you pause or think differently, follow Heart and Brain Health. I'll be here every week, helping you feel stronger, steadier, and more in control of your health. Because you deserve that. You deserve to feel clear, calm, and confident at every stage of life.